From our 22 News Broadcast Center, this is 22 News in Focus.
Welcome to 22 News in Focus. I'm Don Shipman. The COVID-19 pandemic has brought social disparity and inequity issues to the forefront of the national conversation on the well-being of our citizens. Quality of life issues for individuals and communities continue to be impacted, including healthcare, education, and employment opportunities, childcare, also housing. Now, our nation's long history of systemic and institutional racism continues to be at the center of many of these problems. So today on 22 News in Focus, we are having a conversation about disparity and inequity with members of the local community who work for improving these conditions every day. So we have 5 guests joining us here, and we have Dr. Paul Perelia, Chief of the Division of General Medicine and Community Health for Bay State Health. Also, Dr. Sarah Perez McAdoo, University of Massachusetts Medical School, the Population Health Capstone Director. Dr. Jalil Johnson, Director of Psychiatry at the Center for Human Development. Also, Paul Bailey, the Executive Director at Springfield Partners for Community Action. And Ron Johnson, President and CEO at MLK Family Services. I want to first start with what each of you do at your organization and what your organization focuses in on. And we'll start with Ron Johnson.
Hello, Don. Thank you for the opportunity today here. The Martin Luther King Jr. Family Services really exists as a baseline social service organization attempting to address, and very successful in some areas, of being able to address some of the most pressing needs that the community has. Health and nutrition is important, and at the base of that is folks having good quality food, child care, supporting students with their academic pursuits, supporting young folks beyond their needs in terms of tutoring or academic support. During this COVID, we've operated a remote learning center, and we have a number of programs that support parents in how to be able to encourage and support their development as they support the children that they have decided to raise. It's important that we're able to be flexible, but we see ourselves really addressing some of the core social justice issues that happen in society, not just our community, but it's an opportunity for us to be able to be in alignment and do the boots on the ground work with families and children from our community.
All right. But let's go to Paul Bailey now, the Executive Director at the Springfield Partners for Community Action.
Yes, good evening, and thank you for inviting me to this program. I really appreciate that. And my name again, as you said, is Paul Bailey. I'm the Executive Director at Springfield Partners and have been for the past 21 years. Springfield Partners is the federally designated community action agency serving the greater Springfield area. Community action agencies were formed in 1964 under the Equal Opportunity Act that was formed to help fight the war on poverty, if everyone remembers that phrase. We certainly haven't won that war, and we're still fighting it. We fight it with a host of programs that we operate to help people be able to save or be able to work and the like. We have a child care program where we serve 107 kids every day. Infants, toddlers, preschoolers, and we have in-school students as well. We have a weatherization program that we go around all of Hampden County, weatherize homes to make them more energy efficient, and therefore people can save $1 here and $1 there. If they can save on their energy bills, they have some money to spend on other things. We have a veterans program where we help veterans find housing and other needs that they might have. We teach financial literacy. We teach counseling. We have a person in the housing court each week to help folks that are facing eviction, so that they because if they get evicted, things wouldn't be so good at home. And we have some Band-Aid programs also that help people that fall into fall into poverty for a short time. Like, folks need food. We were able to provide that. Folks need help with pain. Of other things like credit counseling and the like.
All right, well, thank you. So now let's go to Dr. Johnson, the Director of Psychiatry at the Center for Human Development. Tell us about what you do and your organization.
Yeah, thank you for having me, and thank you for including the Center for Human Development in this conversation. I think it's really important. My work specifically at this agency is to manage the psychiatric services for 7 outpatient clinics throughout Western Massachusetts. But the agency, the Center for Human Development, has been around for several decades and provides a wide range of services, including counseling and therapy, lots of residential services for people with anything from developmental and cognitive issues, as well as social problems. We also provide residential and long-term sort of treatment residencies for people with dual diagnosis, people with mental health and or substance use disorders. We also work closely with government institutions like the Department of Children and Families to provide services for women, children, and families, and of course, psychiatric services that I mentioned in the beginning.
Dr. McAdoo now from the University of Massachusetts Medical School.
Thank you and good afternoon. It's a pleasure to have this conversation with you today and for inviting me to join you with this. So I am a public health physician and I'm passionate and committed to transforming the health of communities by addressing health inequities and social factors that influence health. My work has mostly focused in public policy, community-based strategies, advocacy, and now my primary focus is on undergraduate medical education. And as you mentioned, I am the Population Health Capstone Director for the PERCH track at the University of Massachusetts Medical School at the regional campus at Bay State. And PERCH is the acronym for Population-Based Urban and Rural Community Health. And PERCH track really helps students to learn how to care for underserved populations by integrated social determinants of health, health equity, health disparities into their biomedical education. It provides them with that content and understanding in order to improve quality care and improve health outcomes.
And now to Dr. Perelia with Bay State Health.
Hi, thank you so much for having me on. I'm representing our community health centers, specifically Brightwood, High Street Adult, and our Mason Square clinics. And, obviously as clinics or health centers, the first thing that we're doing is providing healthcare, but we really are focused on doing so much more than that. We're focused on representing patients who have been traditionally underserved, patients who have significant social determinants of health that get in the way of them being as well as they can possibly be. And so we're working to address those. We're working to partner with community organizations and others to make sure that our patients are taken care of where they are. We're also working to figure out how to circumvent some of the things that are getting in the way. So, if we see that our patients aren't going to get vaccinations, we've started doing the vaccinations out of our clinics rather than waiting for our patients to try to find a way to other ways to get their vaccination. So, I think that we've really been, privileged to be able to try to help the folks we take care of through this pandemic. And,
All right, I'm going to start off here with a rather general question, but what are some of the challenges that you see among the people that you serve that have been impacted when it comes to their quality of life? And I guess I'll start with Dr. Johnson.
I really think it depends on the community. I'm very fortunate to be able to work with communities throughout Western Mass. And what's interesting is that if I, just look at our communities in a clinic that we have in Orange, Massachusetts, for example. It's a very different community and has specific needs compared to the community that we serve in Springfield at our Pine Street location. Different demographics. I mean, a lot of the same kind of overarching problems, but we definitely have to be sensitive to the differences in the community. So some of the problems that we see that I guess you sort of universal, I think, would be the quality of education, literacy, and specifically health literacy. I think that is a huge factor when you're trying to provide care to someone. If they have a hard time understanding what you're talking about, that means that you have to really tailor your education to where they are.
All right, I want to continue the conversation specifically when it comes to education. We're also going to talk about disparities in healthcare. You're watching 22 News in Focus. We're back here now, 22 News in Focus. Today we're talking about social disparity and inequity issues in our community. When we left off, we were talking about the challenges a lot of these organizations and agencies are facing in their community. What are the challenges that people that they serve are facing when it comes to quality of life? And I want to go now to Ron Johnson to talk a little bit more about this. Specifically with MLK, for example, what are you noticing in your community? What are some of the challenges that they're facing?
Well, Don, let's just say at a baseline, prior to the COVID and the revelations of the other part of the country, or parts of the country, relative to racial injustice, the folks that we work on behalf of have always had challenges, whether it be in their healthcare, whether it be in making sure that children are getting great education, whether they have good access to good foods. I'm talking about not dollar store food, but good quality, wholesome foods. Those things existed before the COVID. They have just been exacerbated in our community. So there are others that are now coming to understand finally what segments of our communities all across this country have been experiencing for years. The COVID just had a way of pulling the covers back. So for us, we're working to address some of those social justice issues by the very direct interventions that we do. I mentioned in my opening that one of the things that we did to address some of the stress that families were experiencing was folks need to work, and they were told their children need to be engaged in education, and they had no way of being able to do both their work, their paid work, and make sure their children were taken care of. So we opened a remote learning center. And we did that the very first week of September when schools reopened. So that's just one example of an agency like ours being responsive to a pressing community need. I could give more, but I know that the other panelists have some good thoughts also.
Yeah, speaking of that, let's go to Paul Bailey, the Executive Director of Springfield Partners. What about you? What about your agency? What are you noticing?
I want to echo first what Ron said about, the folks that we serve have had issues and problems and things that we've been addressing for a long time. But COVID has kind of made things a bit more difficult. People losing their employment and the things that we're trying to help folks with is paying back mortgage payments and back rent payments. Those are the two of the bigger things, and people have fallen so far behind, they're trying to get out of a hole, but they really can't. We're seeing folks that, that now are behind, 8, 9, 10 months in their rent, and either they're having to, well, right now there's a moratorium on evictions, so that's holding steady. But as soon as it's over, there's going to be a real problem if we can't get some of these folks settled with some of their rent and mortgage payments.
All right, I want to ask that same question or similar to it because you guys just both mentioned COVID-19. So I think that kind of segues perfectly into that aspect of what we've been dealing with thus far. Let's go to Dr. Johnson on this. How has COVID-19 impacted communities where you are?
I think that it's had a tremendous impact. I mean, for the people that we serve, there's a a wide variety of problems that they might be facing. And sometimes the support that we're providing might be their only support. And when a person is isolated because the world is under, a lockdown, and they cannot get to or access that primary support, it can be quite detrimental to their health. So we've seen this time and time again. We've actually seen a tremendous increase in the need for services because of this isolation, and because people don't have their typical coping mechanisms. They might have resorted to other coping mechanisms to help them manage this situation. And sometimes that's good, but it can be really detrimental to their physical health and their mental health when they are sort of locked away. So this has been a huge problem for us as an agency, and for all of our providers. We're all struggling with it and doing the best we can, but it's been difficult throughout I think all of healthcare.
Fear or misunderstanding of the COVID-19 vaccine is an ongoing problem in a lot of communities, here locally as well. So I want to talk about this. Why is that first, and what's being done to educate and provide people with the access to testing and the vaccine? And I guess I'll direct this question to you, Dr. McAdoo.
Thank you for the question. I think in terms of what you were asking in terms of fear and information that people may be lacking, I think that a lot of effort has been put into increasing education around the virus, as well as the health impacts of it. And even now at this point, in terms of the vaccine, understanding how it works and dispelling the myths, and really giving people the accurate science-based information, and at the same time taking that information and putting it into context in their lives. So trying to address the why is this important, and how does it impact you, your family, your ability to do the things that you love, whether that is spending time with others, whether that's working, going to school. So I think that a lot of efforts have really been much more health prevention and education. That has been the strategies that have been the primary focus. And the more that we've done that, we've engaged people in conversations, and that has been key, and really highlighting what they need to know in order to make an informed decision.
Dr. Pirelli, I want to bring you in on this one, because do you believe the concern people have now with the Johnson & Johnson vaccination is justified?
There's been a lot of concern.
There has been, and I think there's two considerations. One is just thinking about kind of numeracy. And what I mean by that is that there was a very small number of the brain clots, which are a scary thing to happen. But when you think about it in the total number of people who receive the vaccination, it's actually very rare. The other thing is just thinking about the risk that COVID actually brings. So there was recently a report that came out of Brown by the chief of neurology there that showed that the likelihood of getting a brain clot with COVID is 8 to 9 times higher than having had the Johnson & Johnson vaccination. So point in fact, the vaccination protects you against the thing that's more likely to give you the clot. But people are frightened by this sort of information. They don't have the opportunity to sort of know all of this information and see the big picture, and they make a snap decision. I'll tell you, just on a personal level, my 86-year-old mother, who got the Moderna vaccination, by the way, was saying to me the other day, "Mom, I'm glad I didn't get the J&J." And I said, "Well, Mom, that makes no sense." So I think that there's a lot of people who got frightened by what they heard in the press, heard a scary outcome and decided that it was a scary thing. And point in fact, it's far safer, I think, to get the vaccination than it is to get COVID.
I want to stay on this topic with you, because have the efforts thus far been enough to address those concerns?
It's interesting, at least in my experience in talking with other healthcare providers. There is a great appeal to the one and done that Johnson & Johnson sort of affords some people. So we've had patients saying, "That's what I want, that's the one." And then we've had other folks who are frightened by it and don't want it. So it's been a bit of a mixed bag. There was definitely a drop, I think, immediately after the hold was released. People were reticent to take that vaccination. But as we're offering that in the Pfizer now in our clinics, it's starting to even out a little bit.
All right, we're going to continue our conversation once we return. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we are talking about social disparity and inequity issues in Western Massachusetts. There are countless research papers out there on inequities in healthcare, healthcare access, and other social disparities that impact health, such as housing, education, employment opportunities. I want to talk a little bit more about this and how this impacts quality of life and long-term health. We'll go to Dr. Johnson on this one. What are the drivers of poor health outcomes in America, especially for racial and ethnic minorities?
I think that there are many contributing factors, but some of them include the level of income, a level of education opportunities, occupation, employment status, work safety, what kind of work that you actually are engaged in and how safe is that work. Gender inequities are also included in that. Racial segregation based on, historical factors like redlining, but also, as Ron Johnson mentioned earlier, food insecurity and inability to access quality foods, as well as access to housing and to be able to protect yourself from losing your utilities and things like that. So those are some of the factors that I think contribute to a person's health and well-being, for sure.
And can you talk to this point too? Because I think there's a sense that oftentimes we say other, this group of people, but can you explain why it's important that everyone gets a fair shot? It helps the collective, doesn't it?
Of course. I think that that's one of the things that can be is a sort of a misunderstanding, is that there are people that are living in a far away having these experiences. We're all very much the same and very much trying to have the same kind of quality of life. So when we think of people as others, it's a little bit easy to just sort of dismiss their experience. So if we think of everyone having a little bit of a better experience, and this means that the rest of us are going to also have a better experience. We don't have to necessarily deal with some of the spillover from people not having a great experience or a great life. So I think it's better for all of society, for everyone to have a little bit of a decent start in life.
Now, living in a physically healthy environment, access to affordable, safe, and secure housing has been proven to increase positive physical and mental health outcomes. So this question is for Ron Johnson with MLK Family Services. What efforts are being made locally to provide proper housing and prevent homelessness?
I wanted to say that one of the things that contributes to the condition of folks who are greatly impacted the most by the pandemic is a failing school system. Early education and care is extremely important. Children who are attending schools that really just are not matching up to the state levels or the national levels lays a foundation for people to be illiterate, not quite understanding of some of the policies, the protocols that they could take advantage of. So that contributes in some way. I just wanted to not lose that opportunity to be able to speak to that side of the issue. In terms of the issue of homelessness, there are some great efforts that are happening in the city of Springfield, guided by the mayor's office to end homelessness. And I'm not a specialist in that particular area, but there's a great collaboration amongst partners, CHD being one of those organizations that's doing some great work on the side of homelessness as it relates to young people. So we do know that there are concerted efforts in the community to be able to address that.
And Ron, you mentioned the education component there. So how essential is access to education? And here's the key part, the key question. What keeps people from acquiring that education?
Well, we know that the baseline is that education is critical. It's the foundation for most everything. In terms of what the barriers are, we have to accept that there are some systems that just don't want to allocate appropriate resources so that our children can be educated in an urban school setting at the same level as they are in a suburban school district. So it's about politics in many regards, but it's not having the right level of advocacy, and even some of the folks who in the school are well-meaning feel like they are under-resourced to be able to do the work that will produce a great outcome for the children. And then the families need more work also, because many times they've experienced a dysfunctional relationship to their school when they were coming along. So you're sometimes trying to back up and address generational challenges as it relates to fairness in education.
You know, the Biden administration has talked about funding cradle to college. How important is that? That must be critical for what you're doing.
That is huge. When I heard President Biden speak of that and making junior college free and accessible to anyone that wants to be able to attend, that has a way of leveling the playing field on so many different levels. Now, we hope that this won't get caught up in the political mire that other great ideas like this seem to be, unfortunately, sidelined by. But the thinking is in the right pathway right now for creating school districts and educational opportunities that are open to everyone and not just for those who can afford it.
Okay, we're going to continue our conversation. You are watching 22 News in Focus. We are back here now, 22 News in Focus. We're continuing our conversation. We left off talking about education, the Biden administration's push to fund early childcare and also those first 2 years of college at a community college level. We were chatting with Ron Johnson with the MLK Family Services, and he was saying how vital that is, specifically that 2-year college. What about the early education? You touched on that a little bit. Maybe talk more about that.
Well, more resources committed to engaging families and their children with an early education program so that they're matriculating out of a high level, what we would call early childhood experience, as they're being ready to go into elementary school. It's been proven over and over again that those students that are connected with the program like Head Start really do get that running jump to be able to go into a classroom ready to learn, and the teachers are ready to have them be engaged, but the families are critical to being able to encourage reading and literacy. That's a significant piece. So we've got to encourage more parents, because I think there's a good number who are committing to reading to their children, but I think that there needs to be more attention paid to making sure that children have the access to the books, and that's through our libraries and other resources in communities. But it is important to give everyone a best start as possible. Then the research is very clear that those outcomes can be significant.
All right, in full transparency here, we are having a little technical issue with the other guests. So Ron, you're on the spot. We're going to be chatting with you for a little bit here. I have some more questions. We'll fill the time. We have lots of questions to get to. I want to talk about access to a vehicle and how important that is. Reliable transportation, for example, that's so important to the health and well-being of someone. How can we improve that in our local communities?
Well, making the transportation affordable. I was surprised. I'm not one who ever really has to, rely on public transportation, but when I found out what the cost was now, for some families, that's prohibitive in terms of the actual cost for just the fare, and that the routes aren't always easily available in terms of the number of routes and the frequency that they run. So someone has to be really well prepared to be able to know those routes, engage with them in a way that gets them to where they need to go. But it's a difficult thing under the very best circumstances. So more resources that open up to the places that folks need to get to. There's been some discussion about working with the PBTA to have some specific runs that go directly from several locations in Mason Square out to St. James Avenue, which is where there are several mainline grocery stores as a way of helping folks to get connected. Also making sure that buses are running for after school programs also. Do we have sufficient funding through the school district to support after school programming so that children have that vehicle to be able to get to an after school, a high quality after school program. So transportation is important. It's also important for folks to be able to maintain their doctor's appointments also. So transportation is critical.
You know, we've been talking a lot about the pandemic as well and how it's put a spotlight on just how little people actually make, how little they make. A lot of people have multiple jobs. We can talk a little bit more about education, I suppose, here with that. But, you know, what effects would you like to see to improve employment opportunities?
Well, we're in a situation right now where, because there are some resources that are out there, it's a very difficult environment to be able to hire folks in. Now, that's a complete paradigm change prior to COVID impacting us in March of 2020, where, you know, there seemed to be increasing numbers of folks who are just living on the margins, can't get a break to get a job. But now employers are saying that they don't have a field of folks sufficient to be able to hire. So it's a catch situation right now. I'm told that there's going to be a reset on unemployment benefits at the end of the summer, and that we will see a swell of folks who are looking to reengage with being in the workforce. So, you know, that's an important factor. But for right now, there are folks who are riding the wave of unemployment. That's real. I experience it here every day. We're looking to hire direct education, and the number of resumes are considerably lower than what they were 5 years ago when we hired our director of education. The competition was very stiff. I just can't get enough resumes at this point. I see Paul nodding his head. He's probably having the same experience as well.
All right, we'll discuss this further once we return. I know we're kind of ironing out the kinks here. We have more to come. You're watching. We're back here now, 22 News in Focus. Today we're talking about social and health disparity and inequity issues here in Western Massachusetts. And I want to discuss some of the local initiatives now to address racial disparity and inequity. We have Dr. Parelia joining us now here to discuss this a little bit further. I'm going to bring you in because access to health care. What can be done to improve access to all types of health care, from annual exams and screenings to long-term care and even chronic disease?
So I think that what's happened is that we've found that the sort of way we've always done things, which is to bring the patients to us, doesn't work, particularly for access. And I think some of the reasons that, for instance, Ron talking about transportation and the difficulty of getting places. If somebody has to take a couple buses to come to see me at the clinic, they might be late. We try to accommodate, but we're set up to sort of have people coming at particular times. So a good thing that's come out of this, and I will say it's a good thing coming out of a very bad thing, is that we've been able to access people, or have access be better through telehealth. In March of 2020, we went from 0 telehealth visits at the beginning of the month to 80% of the work we were doing by the end of the month being by telehealth. We were able to engage patients that we hadn't been engaging because they could finally connect with us in a way that worked. I think there's still a long way to go. And there are some areas where obviously we are lagging. Some of those areas are things like management of blood pressure. It's hard to take a blood pressure if the person's arm isn't there to take the blood pressure. We've seen some slippage in vaccinations, in particular, childhood and adolescent vaccinations. Even despite this, we've done a lot of work to try to get the children in who are due for their wellness exams, bring people face to face when we need to bring them face to face. But this mixed model of telehealth has been something where I think has actually been an evening factor. One of the things, though, that's still a big gap is there's a digital divide. So one of the things that's sort of in between a telephone visit and a face-to-face visit is a video telehealth visit. It's hard to do that if your patient doesn't have the digital literacy to know how to work the devices, if they don't have access to Wi-Fi, if they don't have access to a device. All of these sort of impact that modality of care. And I think it's critically important, not just in healthcare, but in education, in being able to look for work, being able to order food. There's so many different ways that digital access is important. And so I think that in some ways, I think that the pandemic has helped us in terms of access, but obviously there's still a long way to go.
I would say the president's infrastructure plan would help with broadband. Let's bring in Dr. Johnson now. How do we get health professionals to treat all patients equally? And is that really necessary to treat them all equally?
I believe it is. I think there are a few ideas or concepts that any agency can start to look at. Some of those being education for leaders and for all staff in terms of, just looking at implicit bias and things like that. And so just kind of giving everyone a base of education in terms of how they view the world and how their bias may affect care. I also think that, agencies can do things like, integrate the social determinants of health into their health assessments. So as you are meeting a provider, they should be collecting some of that information so that we can actually figure out why you're not doing well. Medicine and a lot of healthcare is derived by, working with 50-year-old white men, right? So, but the whole population in the United States doesn't look like that. And we need to try to look at all of the people that we serve and find out if they're not responding to treatment, maybe it's there's something in the way, and try to collect some of that information. So I think agencies can do that. And then also we can remove outdated institutional practices that may be discriminatory or inhibiting people from accessing care. And that's a big topic. But I think an agency that looks at that is getting ahead of the game here and improving access and making sure that all of their staff are treating all of their patients or the clients or the people they serve in an equal kind of way.
Yeah, and I think I want to make it clear the way I brought up that question about equality and whether that's necessarily important, because I'm thinking of like the disparities that we have in our society. So if there's a problem in one section, should we devote more resources to where there's an issue? That's where I'm getting at that. If you can maybe talk a little bit more to that point.
Yes, absolutely. So, if we have some air to put in four tires and one of them is really flat and the other ones are a little flat, we put more air in the really flat one, right? So we want to look at all of the people in the community and try to figure out who needs the resources, right? So that's what we're doing. So if we need to put more resources in a particular part of the community, I think that's a reasonable thing to do as a person who's managing, whether it's just a small practice or a clinic or a giant agency. We have to know where to devote our resources. And in doing so, we do make it fair and equitable across the board, because we lift the whole community up in that way.
Substance abuse and mental wellness. There's a shortage of beds for people seeking help. Recently, Bay State Health said types of treatment options are available, especially for people who are low income or don't have insurance. So I guess we'll start with you, Dr. Johnson. Maybe you can highlight this for us and talk a little bit more to this point.
Are you talking specifically about the shortage of beds?
Yeah. Yes.
Well, I mean, I think Paul may be able to speak better to that in terms of the inpatient side, but I can say that in general, we have seen a shortage across the country, throughout our state and in our region, when it comes to the mental health treatment, as well as treatment for substance use disorders. And I think that we've been trying to compensate for that. We've had people, primary care doctors have been picking up the slack for quite some time, trying to fill in the void. We've had, some schools have started to add to their curriculum to try to produce more clinicians. So we've seen an attempt to get more providers into the community, but the shortage is, it was a really deep hole that we were in, and we're nowhere near climbing out of it. In terms of the beds.
And Dr. McAdoo.
Let's move to you and ask you that same question. And I also want to talk a little bit about, cultural differences, religious differences. How can we mentioned, that 50-year-old white male doctor maybe can't connect well with a minority community, for example. How do we get more minority doctors out there?
That begins, when you think about how did we get here, the earlier conversations around education and changing our education system, it begins all the way back there in terms of really giving everyone quality education, easy access to that. All the things that Mr. Ron Johnson brought up is fundamental. And then being able to build the pipeline so that students can get to medical school or other health profession programs. That provides them with the opportunity to reach their goal of whether it's becoming a doctor, a nurse, or other fields. I think that there's a lot of work that needs to be done there, and then supporting, students of color in their success in college. I think that they have additional challenges that may be different than other students who have more resources and access. There's students who might have to have, and I remember myself having about 3 different jobs while going to college, and some other challenges that they may, and other responsibilities that they may have while they're going through school. So addressing some of those things increases the ability for students to reach the goal of pursuing, in the health field or the medical career, in addition to increasing, the opportunity for students to enter these fields. So there's a lot of work to do, but I always think about that unfortunately, it's not a silver bullet, simple answer to this. It's usually a progression of certain either policies, programs that must be linked together to create a pipeline for young people to enter into these professions, to then have a more diverse workforce in healthcare. And I think that that's critically important. And there's some studies that have shown how the concordance of the background of a physician, improves the relationship and, and the interaction with the patient to improve health outcomes. But I think that there's other things that could be done also within medicine in of itself to really prepare providers to think about not just sort of how to relate to the patient, versus language, but thinking about cultural humility, understanding where people are at, understanding a little bit more about being curious about the individual, understanding a lot more of their story, to be able to identify what is the approach and the way that they should be able to understand how their life experience impacts their ability to tell your story. And that information then translates to probably increasing the chance that you're able to understand, making the diagnosis and then selecting the treatment or the care plan that would that matches that person the best. So I know I give you a long answer, but to be honest with you, I think this starts way back in providing education and access to the programs that's going to increase the number of students of color who enter into the field.
No problem at all. That's why we devoted an hour to this. I mean, I know we could even talk more because there's a lot of nuance here. I want to talk about health insurance coverage. A lack of insurance may stop people from seeking medical treatment, even important annual screenings and checkups. So what's available locally to help people get health insurance for themselves and for children? And I guess we'll go to Paul Bailey with Springfield Partners.
Well, obviously health insurance is extremely important. Many of our clients, that's one of their problems in not having appropriate health insurance so that they can take care of their medical and other needs. We're working with the state and with the health providers to try to get people enrolled in health insurance, and it's kind of it's a tough thing. Either you can or you can't get it, and it obviously it's critical to people having people stay in certain jobs. They don't want to advance. I've got some employees in my organization that they emotions, et cetera, because if they move up, the ranks a little bit and get a little bit more pay, that takes away their health insurance, mass health, et cetera. And that's a big problem that we're having, folks, just because of the cost of health insurance, they rather stay in the insurance industry, like mass health, et cetera.
Bay State Health is the new regional campus for University of Massachusetts Medical School, the PERCH track, population-based urban and rural community health, that is. So how are students engaged in COVID-19 mitigation efforts in the community? This question is for Dr. McAdoo, please.
Our students, from the moment the pandemic began, were very eager to be right at the front line, but that wasn't always possible at the very beginning for lots of other factors. And our students were ready to volunteer to help out any way they can. And from that sprung up a student volunteer corps that over the time has grown. Students have volunteered from various health profession programs. So I actually had moved from focus on the medical students to broaden the opportunity for students from other health profession programs to come into this larger volunteer corps, and then connect those students to opportunities in the community, from tracking resources that people could use during the pandemic to meet their basic needs, to also being involved now in vaccination efforts. And that part has grown pretty significantly in the last few weeks, where students are part of this volunteer corps. About 100 students had expressed interest, and those students are given the opportunities to volunteer at different clinics. This is also in connection to the Springfield Department of Health and Human Services vaccination sites. Students have been in Springfield as well as Holyoke to provide some support to those vaccinations. Some of them are actually doing the vaccine administration. Some are doing some of the supports during that time. But students are really looking for the opportunity to help the community as much as possible. And that allows them to get to know the community better, to understand, interacting with those that live there, understanding some of the other factors that influence their access to vaccines, their understanding of it. So students have really trying to increase the opportunity to really be engaged during these vaccination efforts.
All right, we're going to come back with the final word right after the break. Stay with us. You've been watching 22 News in Focus. Today we've been discussing social and health disparity and inequity issues facing underserved and at-risk people in our community. I want to thank our panel for joining us here. We just scratched the surface here. I know there are so many more things that we could have gotten to. Definitely want to have you back on again, and possibly do so when we can do so in person here at 22 News. So again, thanks for coming on the program. Thanks for watching as well. If you missed any of this, you can watch it as well on our website at wwlp.com. Have a good day.